Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Hello dear ladies and gentlemen. In today's lecture we will discuss about hemodynamics disorder, the pathology of hemodynamic disorder in detail. So first of all we are coming to the introduction of hemodynamic disorder. The health and well-being of a cell and tissues depend not only on an intact circulation to deliver nutrients, but also on normal fluid homeostasis. This chapter revives the major distribution involving the hemodynamic system. Now we are coming to discuss with you edema. So what is edema? Edema is increased fluid in the interstitial tissue spaces, or it is a fluid accumulation in the body cavities in excessive amount. This condition, also known as dropsy and hydropsy, is an abnormal accumulation of fluid in the interstitial located beneath the skin and in the cavities of the body. Now we are coming to discuss with you causes of edema. So several factors can contribute to the formation of edema, including the following: increased hydrostatic pressure, reduced colloidal oncotic pressure within blood vessel, increased tissue colloid pressure, increased blood vessel permeability, e.g. inflammation, obstruction of fluid clearance in the lymphatic system. So now we are coming to discuss with you pathophysiology of edema. Accumulation of interstitial fluid is regulated by the forces of the Starling equation. Hydrostatic pressure within the blood vessel tend to cause water to filter out into a tissue. This leads to a difference in protein concentration between the plasma and the tissue. As a result, the colloidal or oncotic pressure of the higher level of protein in the plasma tend to draw water back into the blood vessel from the tissue. Starling equation states that the rate of leakage of fluid is determined by the difference between the two forces and also by the permeability of the vessel wall to water, which determine the rate of flow per a given force imbalance. Most water leakage occur in capillaries or post-capillary venule, which have a semi-permeable membrane that allow water to pass more freely than protein. If the gaps between the cell of the vessel wall open up, then permeability to water is increased, and as the gaps increase in size, permeability to protein also increases. Changes in the variable thus in Starling equation can contribute to a formation of edema, either by an increase in hydrostatic pressure within the blood vessel or decrease in oncotic pressure within the blood vessel, or an increase in vessel wall permeability. The latter has two effects: it allows water to flow more freely and it reduces the colloidal or oncotic pressure difference by allowing protein to leave the vessel more easily. Raise hydrostatic pressure upon retention of water and sodium by the kidney. Sodium and water retention occur in various pallor and renal failure. In these contributions, the retained sodium and water result in increased capillary hydrostatic pressure, which lead to edema seen in these diseases. Now I am coming to discuss with you clinical classification of edema. So edema is referred as fitting when pressure is applied to a small area and the indentation persists after the release of the pressure. Peripheral fitting edema is the more common type, resulting from water retention. It can be caused by systematic disease, pregnancy in some women, either directly or as a result of heart failure, or local conditions such as varicose vein, thrombophlebitis, insect bite, and dermatitis. Non-footing edema is observed when the indentation does not persist. It is associated with such conditions as lymphedema, and myxedema. Also, we can clinically classify edema into localized and generalized types. Its localized types are deep venous thrombosis, pulmonary edema, brain edema, lymphatic edema, and its generalized types are nephrotic syndrome, liver cirrhosis, malnutrition, heart failure, renal failure. Generally, edema may be caused by malnutrition, kwashiorkor are due to raised hydrostatic pressure in cardiac failure and also in osmotic pressure pulse, a nephrotic syndrome and liver disease, as well as the previously mentioned condition edema often occur during the late stage of pregnancy in some women and is usually found in the lower part of the legs. Organ-specific edema. Edema may occur in specific organ as a part of inflammation or other mechanism. Example of organ-specific edema are cerebral edema. This is the extracellular fluid accumulation in the brain. It can occur in toxic or abnormal metabolic state and conditions such as reduced oxygen at high altitude. It causes drowsiness or loss of consciousness. Now I am coming to discuss with you pulmonary edema. This type occurs when the pressure in blood vessel in the lung is raised because of obstruction of blood in the pulmonary vein. This is usually due to a failure of the left ventricle of the heart. It can also occur in altitude. Sickness or inhalation of toxic chemical. Pulmonary edema produces shortness of breath. Pleural effusion may occur when fluid accumulates in the pleural cavity. Now I am coming to discuss with you corneal edema. This may also be found in the cornea of the eye with glaucoma, severe conjunctivitis, keratitis or after surgery. Now I am coming to discuss with you perioorbital edema. Edema surrounding the eyes and is also called eye pupillus. The perioorbital tissue are most noticeably swollen immediately after waking up, perhaps as a result of the gravitational redistribution of fluid in the horizontal position. Now I am coming to discuss with you cutaneous edema. Common appearance of cutaneous edema are observed with mosquito bites, spider bites, bee stings, wheel and flare and skin contact with certain plants such as poison, which are term contact dermatitis. Another cutaneous form of edema is mesoedema, in which there is an increased mucinous substances deposit into tissue matrix. Now I am coming to discuss with you lymphedema. This is an abnormal removal of interstitial fluid caused by failure of the lymphatic system. This may be due to obstruction from cancer or enlarged lymph nodes, destruction of lymph vessels by radiotherapy or infiltration of the lymphatics by parasites such as filarial elephantitis. Now I am coming to discuss with you hydrospitalis. In this condition, the fetus is characterized by accumulation of fluid or edema all over the body. Now I am coming to discuss with you laryngeal edema, commonly occur in hydrogen poisoning. So now we are coming to discuss with you hemorrhage. So what is hemorrhage? Hemorrhage, also called bleeding, is an escape of blood from the blood vessel, artery, vein, capillary or heart. Is a result of trauma, inflammation, neoplasia or abnormal hemostasis. Classification of bleeding according to affected organ. Cardiac bleeding. This is usually caused by penetrating wound or rupture of ventricle as a result of myocardial infarction. Now I am coming to discuss with you arterial bleeding. This is usually caused by the trauma or rupture of the aneurysm. Now I am coming to discuss with you capillary bleeding. This is usually caused by trauma or surgery. It may also occur in variety of a disease characterized by weakness of vessel wall, e.g. Ehlers-Danlos syndrome, vitamin C deficiency and platelet disorder, idiopathic thrombocytopenic purpura. Now I am coming to discuss with you venous bleeding. This is commonly caused by trauma or surgery. Classification of bleeding are, according to a site, bleeding include the following entities: external bleeding, visible bleeding outside the body or extravasation into tissue and swelling. This is called hematoma. Now I am coming to discuss with you internal bleeding, intracavity, i.e. interperitoneal cavity or intracranial bleeding. This is not visible. Now I am coming to discuss with you local bleeding caused by trauma, inflammation, neoplastic infiltration of blood vessel. Generalized bleeding commonly caused by factor deficiency like hemophilia, DICN, platelets count and function abnormalities. Important terminology in bleeding are pitchai, purpura and ecchymosis. All the three terms refer to hemorrhage into skin and mucosae. Pinpoint hemorrhage smaller than 1 millimeter are also called pitchai. Those measuring 1 mm to 1 cm in diameter are called purpura, and those larger than 1 cm are called ecchymosis. Note that pitchai upon become confluent and become purpura or ecchymosis. To complicate matter, the term purpura is also used for several diseases characterized by widespread cutaneous hemorrhage, e.g. thrombotic, thrombocytopenic purpura and henchosclenic purpura. Goodbye, my dear ladies and gentlemen. In next lecture, we will study about hematoma. So, if you like my lecture, please subscribe and press the bell icon and share with others.